Have you ever wondered what happens when you take Xanax for an extended period? Xanax, a commonly prescribed medication for anxiety and panic disorders, can indeed be a lifesaver for those in the throes of debilitating anxiety. But while it's a boon for short-term relief, the story changes dramatically when it's used over the long haul. Serious side effects can creep in, turning a remedy into a risk. So what really happens when Xanax becomes a long-term companion? Let's delve into the hidden risks of long-term Xanax usage. Xanax, also known as alprazolam, is a powerful benzodiazepine. It's a prescription medication with a significant role in the medical field, particularly known for its calming effects. Xanax works by enhancing the activity of certain neurotransmitters in the brain, inducing a tranquil state. This makes it an effective tool in managing disorders marked by excessive anxiety and panic. However, like a double-edged sword, Xanax's potency is both its strength and its potential downfall. Its effectiveness in bringing about calm also makes it a substance with a high risk for dependency and addiction. It's crucial to remember that Xanax is typically prescribed for short-term use. This is because over time, the body can develop a tolerance to the drug's effects, leading to increased dosages and ultimately, dependence. The question then arises, what happens when Xanax is used for a prolonged period? Let's delve deeper into the world of this potent benzodiazepine and its long-term effects. To answer that, we turn to the experts. Dr. Jane Patterson, a renowned psychiatrist, shares her insights. Xanax, or alprazolam, is often prescribed for anxiety disorders or panic attacks. However, long-term usage can lead to physical dependency. This means that the body starts to rely on the drug, and stopping it suddenly can cause withdrawal symptoms. These symptoms can range from restlessness and insomnia to more severe cases like seizures. Dr. Patterson's observations are echoed by neurologist Dr. Mark Williams. Xanax impacts the brain's gamma-aminobutyric acid, or GABA, receptors. Over time, these receptors can become less responsive, leading to a need for increased dosages. This can pave the way for a vicious cycle of dependency and withdrawal. Clinical psychologist Dr. Laura Simmons weighs in on the cognitive effects. Patients on long-term Xanax treatment may experience cognitive impairment. This can manifest as memory problems, difficulty concentrating, and slowed processing speed. Unfortunately, these effects may not fully reverse even after discontinuing the drug. Lastly, we hear from Dr. Robert Collins, a mental health expert. Emotionally, long-term Xanax use can lead to a numbing effect, where patients may feel detached or indifferent. It may also exacerbate symptoms of depression. It's crucial to remember that while Xanax can be effective for short-term relief, it's not a long-term solution for managing anxiety or panic disorders. In a field where opinions often diverge, it's telling when experts agree. And in this case, they do. As psychiatrist Dr. Emily Peterson puts it, patients and healthcare providers need to be aware of these potential risks. Anyone considering long-term Xanax usage should discuss it thoroughly with their healthcare provider and explore other treatment options. The consensus among these professionals is clear. While Xanax can provide immediate relief for anxiety and panic disorders, its long-term use carries significant risks. Physical dependency, withdrawal symptoms, cognitive impairment, and emotional effects are all potential consequences that warrant serious consideration. As we can see, the experts are unanimous in their warning about the long-term usage of Xanax. So let's summarize the key points about the long-term side effects of Xanax. We've heard from the experts and the consensus is clear. Xanax is not meant for prolonged usage. The first and most pressing concern is the risk of dependency. Even when used as prescribed, Xanax has a high potential for addiction. It's a rapid-acting medication that can create a sense of calm or euphoria, making it all too easy for the body to crave that feeling again and again. Before you know it, you could be caught in a cycle of needing more to achieve the same effect, a classic sign of dependency. But dependency is just the tip of the iceberg. Withdrawal from Xanax can be a severe and brutal process. Symptoms can range from restlessness and anxiety to more serious conditions like seizures. The longer you've been using Xanax, the more intense these withdrawal symptoms can be. And let's be clear, withdrawal isn't just about the physical discomfort. It can disrupt your life, affecting your ability to work, maintain relationships, and even carry out simple daily tasks. And then there's the potential for cognitive and emotional effects. Long-term use of Xanax can impact your memory, concentration, and mental clarity. It can leave you feeling emotionally numb or detached, and in some cases, lead to depression or anxiety, the very conditions it's often prescribed to treat. What's more, these effects aren't always temporary. In some cases, they can be long-lasting and potentially permanent, affecting your quality of life in profound ways. So why is this important? Because understanding the potential consequences of long-term Xanax use can help you make informed decisions about your health. It's not about creating fear, but about fostering awareness and promoting safe and effective use of medication. These are the hidden risks, the dark side of Xanax that users need to be aware of. In conclusion, while Xanax can be beneficial for short-term use, its long-term effects paint a different picture. This powerful prescription medication, used to treat anxiety and panic disorders, can indeed provide relief in the short term. However, it is crucial that its long-term usage can lead to a dark alley of health complications, dependency, and withdrawal symptoms. Let's underline this. Xanax is not an inherently evil substance. Like any tool, it is the misuse and abuse that lead to detrimental outcomes. The key lies in responsible usage, under the vigilant guidance of a healthcare professional. This is not a medication to be experimented with or used recreationally. It's a potent tool in the medical arsenal designed to help manage specific conditions, but with a potential for serious side effects if misused. If you or someone you know are wrestling with Xanax dependency, there's no shame in seeking help. Reach out to a healthcare professional or a local support group. There are numerous resources available to help navigate the path to recovery. The journey may be challenging, but the destination, a life free from dependency, is undoubtedly worth every step. The mind and body you have are the only ones you get. Treat them with care, respect, and kindness. Your health truly is wealth. Don't gamble it away with long-term Xanax use. If you found this video informative and want to learn more health and wellness, don't forget to subscribe to our channel. Stay tuned for more.